Hello. I need your full attention for the next few minutes. What I'm about to share could genuinely save your life or the life of someone you love. What if I told you that two of the most common, seemingly safe medications, one maybe for your heart, another for a simple ache, could create a life-threatening emergency if taken together? There's a date I'll never forget, March 14th, 2019. That's the day a patient's daughter called me after the funeral and asked a question I couldn't answer. Why didn't anyone tell us? Her mother was one of 1.3 million seniors who end up in emergency rooms every year because of adverse drug reactions. But here's what makes her story different and what should terrify you. I knew. I saw two deadly drug combinations in her chart. I assumed someone else would catch it. The cardiologist, the pharmacist, someone. That assumption cost a woman her life. And here's the number that haunts me most: 0. That's how many warnings most patients receive before they swallow dangerous combinations like this one. Today, in the next few minutes, I am going to expose two of the most dangerous combinations. The first one involves a medication sitting in millions of medicine cabinets right now, used for simple aches and pains. The second one involves two medications that are prescribed by doctors every single day, often to the same person, without fully realizing the deadly risk.
All right, let's get into the first dangerous combination that every person over 60 needs to know about. This first pair is sneaky because one of the drugs is a lifesaver, and the other one seems completely harmless. The first combination to never take together without explicit direct approval from your doctor is warfarin and NSAIDs. Let me break that down. Warfarin is the medication you probably know as Coumadin or Jantoven. It's a very common blood thinner. If you have a condition like atrial fibrillation or AFib, your doctor prescribed this to prevent a blood clot from forming and causing a stroke. If you've had a deep vein thrombosis or a DVT, you're on this pill. It is a critical, life-saving medication. The second part of this dangerous pair is NSAIDs. That stands for non-steroidal anti-inflammatory drugs. You know them by their brand names: ibuprofen, which is Advil or Motrin, and naproxen, which is Aleve. So why does this combination seem safe? Well, your cardiologist prescribed the warfarin. It's protecting your heart, protecting you from a stroke. You take it exactly as prescribed. But then, a few days later, your arthritis in your knee flares up, or you get a tension headache. What do? You do what you've done for 30 years. You go to the pharmacy or your own medicine cabinet and you grab an Advil, or maybe an Aleve because it lasts all day. It's just a painkiller. It's over the counter. You don't even need a prescription. What could be safer? Here is the hidden, critical danger. Warfarin works by thinning your blood. To put it simply, it makes it harder for your blood to clot. This is what prevents the dangerous clots from forming in your heart or legs. Now here's what most people don't know. NSAIDs like ibuprofen and Aleve also have a mild blood thinning effect. They affect the platelets in your blood. So when you take them with warfarin, you're essentially double thinning your blood. Your blood's clotting ability can drop to dangerously low levels. But that's not even the main problem. The biggest danger is this. NSAIDs like ibuprofen and Aleve are known to be harsh on the stomach lining. They can cause irritation and in some cases small ulcers or bleeding in the stomach or intestines. Now think this through. If you are a healthy 40-year-old and you get a tiny microscopic bleed in your stomach lining from taking ibuprofen, your blood clots it instantly. You never even know it happened. But if you are 70 years old and you are taking warfarin and your blood's clotting ability is already low, that tiny unnoticeable ulcer doesn't clot. It bleeds, and it bleeds, and it bleeds. This can lead to a massive, life-threatening gastrointestinal bleed. The statistics on this are terrifying. A major study published in the Journal of the American Medical Association looked at this exact problem. It found that patients on warfarin who also started taking an NSAID had double the risk of a serious upper gastrointestinal bleed compared to those who were just taking the warfarin alone. Double the risk just from adding a harmless over-the-counter pain pill. So what is the safer alternative? If you are on warfarin or Coumadin and you have pain, what can you do? For most people, the only over-the-counter pain reliever that is generally considered safe with warfarin is acetaminophen, which you know as Tylenol. Acetaminophen works differently. It does not affect your stomach lining, and it does not affect your blood's clotting ability. However, and this is a very important however, you must still be careful. You should never take more than the recommended dose. Taking very high doses of Tylenol, over 3,000 milligrams a day, can actually interact with warfarin and make your blood too thin, increasing your bleed risk. The bottom line is this: if you are on warfarin, you should never take ibuprofen, Advil, Motrin, naproxen, or Aleve. Stick to Tylenol for simple pains, and stay within the recommended dose. For chronic pain like arthritis, talk to your doctor. They can recommend safer options like physical therapy, topical gels, or other prescription medications that don't carry this bleeding risk. That is one hidden danger that's easy to avoid once you know about it. But this next combination, this one truly frightens me as a practitioner because it doesn't involve an over-the-counter pill. It involves two different medications, both prescribed by doctors, often with the best of intentions. And the consequences can be immediate and final.
Before we delve into the second, if you have learned something new, please do well to like and subscribe for more insightful health tips. The second combination that no senior should ever be on without monitoring from a specialist is a class of drugs called benzodiazepines, taken together with a class of drugs called opioids. This is one of the most deadly combinations in all of medicine. Let's use the simple names. Benzodiazepines, you'll know these as Xanax, Alprazolam, Ativan, Klonopin, or Valium. These are powerful medications. Doctors prescribe them for severe anxiety, panic attacks, or sometimes for insomnia and sleep. Opioids, you will know these as oxycodone, OxyContin, Percocet, or morphine. These are powerful and often necessary pain medications. A doctor will prescribe them for severe pain, perhaps after a major surgery like a hip or knee replacement, or for severe chronic pain from a back injury. So why does this seem safe? Both are prescribed by a doctor. That gives them a halo of safety, and it's easy to see how someone ends up on both. Imagine this. A 68-year-old woman has been taking a low dose of Xanax for years to help with anxiety and to sleep. It's prescribed by her primary care doctor. Then she falls and breaks her hip. She has surgery. The surgeon, who is focused on her hip and her pain, prescribes her Percocet for the pain. The surgeon might not know about the Xanax. The primary care doctor might not know about the Percocet. The patient, you, are just taking what the doctors told you to take. You're in pain, you're anxious, it makes sense. Here is the hidden deadly danger. Both of these medication classes, benzodiazepines and opioids, are central nervous system depressants. In simple terms, they both work by slowing your brain and your body down. This is why they make you feel calm or sleepy and why they block pain. But they also slow down your breathing. When you take one of these drugs, your brain has a built-in safety mechanism. If your breathing slows down too much, your brain sounds an alarm and forces you to take a breath. But when you take them both together, that safety mechanism is completely overwhelmed. It's like pressing the brake pedal on your car and then having a second person stomp on that same brake pedal with all their weight. Your breathing can slow down and slow down and slow down until it stops completely. This is called respiratory depression. It's not dramatic, it's silent. The person often just falls asleep and never wakes up.
This is not a rare one-in-a-million risk. This is a common, well-documented danger. The National Institute on Drug Abuse, or NIDA, reports that in studies of people who died from an opioid overdose, over 30% also had benzodiazepines in their system. The risk is so high that the CDC has issued specific warnings to all doctors, telling them to avoid prescribing these two drug classes together whenever possible. Some studies show that taking opioids and benzodiazepines at the same time increases your risk of a fatal overdose by up to 10 times. This is especially dangerous for us as we get older. As we pass 60 and 70, our bodies don't clear these medications as quickly. The drugs stay in our system longer, building up. A dose that was fine at age 50 can become a toxic dose at age 70. Let me tell you about a woman I'll call Margaret. Margaret was 76. She was a wonderful grandmother, full of life, but she suffered from terrible chronic back pain from spinal stenosis. Her pain doctor managed it with a low and consistent dose of hydrocodone. She also had trouble with insomnia and anxiety, and her primary doctor had her on a small dose of Klonopin to help her sleep. She'd been on this combination for almost 2 years. She was stable. One night, her back pain was particularly bad. She couldn't get comfortable, so she took one extra pain pill. Just one. She thought, it's what the doctor prescribed, one extra for breakthrough pain. But that one extra pill, on top of the Klonopin she always took for sleep, was enough to tip the scale. It was too much for her 76-year-old body to handle. Her daughter found her the next morning. She had passed away peacefully in her sleep. She had simply stopped breathing. This story is an absolute tragedy because it was completely, 100% preventable. So what are the safer alternatives? This is about communication. You must be your own biggest health advocate. First, if you are already taking a benzodiazepine like Xanax or Ativan for anxiety or sleep, and a doctor wants to prescribe you an opioid for pain, you must stop them and say, "Doctor, I need you to know I am also taking this other medication. Is it safe?" They may give you a much lower dose of the opioid, or better yet, they will find a non-opioid alternative for your pain. There are many. For nerve pain, there are drugs like gabapentin. For surgical pain, they can use specialized nerve blocks and non-narcotic pain relievers. Second, if you are struggling with anxiety or sleep, talk to your doctor about non-benzodiazepine options, especially if you also have chronic pain. There are other classes of anti-anxiety medicines like SSRIs that are much safer. And for sleep, cognitive behavioral therapy for insomnia, or CBTI, has been proven to be more effective in the long run with 0 side effects. Whatever you do, never just stop taking a benzodiazepine cold turkey. That can be very dangerous. You must work with your doctor to taper off it safely. But please, have that conversation. So let's recap the 2 deadly combinations we discussed today. Number 1, the blood thinner warfarin, Coumadin, mixed with over-the-counter NSAIDs, ibuprofen, Aleve. This combination can lead to catastrophic stomach bleeding. The safer alternative for pain is acetaminophen, Tylenol, taken at the correct dose. Number 2, the anxiety or sleep medications, benzodiazepines, Xanax or Ativan, mixed with opioid pain relievers, Percocet or Vicodin. This combination can slow and then stop your breathing. The safer alternative is to be your own advocate and demand your doctors find non-opioid pain control or non-benzodiazepine options for anxiety. The biggest lesson here for all of us over 60, over 70, and beyond is that less is more. Our bodies process medications differently than when we were 30. We are more sensitive, and the more medications we take, what doctors call polypharmacy, the higher our risk of a dangerous interaction becomes. So here is your homework. I'm giving you one simple, powerful action item that could save your life. I want you to do what we call a brown bag review. The next time you go to your doctor, or even just to your local pharmacist, I want you to take every single pill bottle you own, your prescriptions, your over-the-counter pills, your vitamins, your herbal supplements, everything. Put all of them into one single bag.
Hand that bag to your doctor or pharmacist and ask them one simple, critical question. Is there anything in this bag that could be dangerous for me? Are there any interactions I need to know about? Can anything here be stopped? You are the captain of your own health team. Your doctors and pharmacists are your expert advisors, but you have to be the one to bring them all together. Thank you so much for taking the time to invest in your health. It is the most valuable and precious thing we have. If this video was helpful, please click that like button and, more importantly, share it with another senior, a friend, or a family member you care about. You never know whose life you might save. Stay safe, stay informed, and be your own best health advocate.